Working in numerous war zones in the world, WAHA is one of the most active medical NGOs on the front lines of Mosul.
We started with only a few medical providers, national staff, but after 1 year of working in Iraq, we are talking about more than 500 personnel. We run 15 projects, including 2 hospitals. We are working inside camps and in the most critical areas. WAHA International, it's one of the frontliner associations. For example, in Al-Zahra, on a daily basis, we receive more than 200 patients. In Kayara, in the hospital, in 1 month, we conducted more than 100 C-section, in addition to hundreds of consultations.
Donc on a une maternité qui tourne 24 heures sur 24, 2 blocs opératoires et une salle d'urgence aussi.
We have 150 people working for our hospital that we rehabilitate the ground floor, and it was completely broken.
Nous sommes à l'entrée du bloc opératoire des services de chirurgie de l'hôpital Gayara, tenu par WAHA.
Jack, from France.
Thanks to the demining and rehabilitation work completed by the WAHA team, the hospital of Kayara can take in new patients again. Some of the injured people coming from West Mosul have first been stabilized at medical points on the front line.
Good job, doctor. Good job.
Thank you.
Facture fermée.
Oui, oui, je vois, je vois. Okay.
Kayara Hospital is also a reference hospital for the whole district, providing reproductive health services for women, including an operating theatre dedicated to performing C-sections.
احنا كل مرة من يطلع الطفل
لا بس لا تخليني فيه مباشرة. هاجي عليك. يلا رجع.
Now we are in Zahra PHCC in the east side of Mosul. So about 14 nurses, 4 doctors here in the ER, and we have in the maternity 8 nurses, 3 doctors.
This is the first blood bank in Mosul.
Located in the heart of East Mosul, Al-Zahra Emergency Center receives, since the beginning of the liberation of the area, end of 2016, more than 200 patients per day, including a number of war victims.
X-ray, X-ray.
إن شاء الله. والساعة شلون؟
2 days ago, we went to the west coast of Mosul. We're going to Al-Ma'mun, PHCC there, and then we are going in front of it to Al-Mansur, which is a very dangerous place, but we took our crew, the nurses, and Dr. Sadoun here is a surgeon. We go by 2 ambulances. We receive a lot of cases, injuries, people, bullets, whatever. We treat about 50 cases.
On top of operating in the zones of conflict, WAHA runs healthcare facilities for women in the refugee camps built around Mosul.
Right now, if you are asking about the population of the camp, right now they are reaching 46,000. So now we are facing like a more complicated cases, because ISIS are surrounding them more than 2 years. So you're gonna see here 2 beds. It's just preparing the patients if she had a delivery.
Except for C-sections that are referred to Erbil, the majority of pregnant women are taken care of by WAHA in a mobile delivery unit.
Since she got 7 babies, so it's okay if we do it here. We can do it. If she has no risk factors that we can manage later, like blood pressure, high blood pressure, or bleeding, or any other things.
This Yazidi woman, who doesn't know that her husband was killed by ISIS, will give birth in the mobile clinic to little Anas, her 8th child. Thanks to local skills and the experience of well-known humanitarian medical professionals, WAHA offers in and around Mosul health services for displaced populations and people directly touched by the fightings.
WAHA in Primary Healthcare Center of Debeka, we care about women, human health, gynae and obstetric health. We have also delivery room for the women. Yesterday about 20. We help women here.
Occupied by ISIS for a long time and enduring the killing of many Yazidi people, the city of Sinjar was destroyed by the bombings of the coalition. 2,000 Yazidi families were forced to flee to the mountains with limited access to basic resources and are now unable to return to their homes. The only NGO present in the Sinjar mountains, WAHA, offers health services where it is needed and when the population cannot move freely.
كوابو دكتورة الفيدرة دكتور خليل ودنيرس الفيدرة جي خدمة عملتي خود من الفيدرة كبتري سنة ساقي حتى بسنة ساقي حتى بسدو بنجي روجين ماشين أكتر يا أنزارو كنويت كرونيك ديزيزن.
Even if most refugees have no other choice than the Sardashti camp, where WAHA offers primary health services, some patients, and especially women, can be referred to the WAHA rehabilitated Snouni hospital, 30 minutes away from the camp.
We are here now in Snouni hospital. We as WAHA NGO bring the gynecologists and the nurses here to help the people and the delivery cases. The people here is very need to be helped because as WAHA we are the only NGO here to support the delivery cases in all the Sinjar district.
أشوفك وين يا مهاجر قل لي بأي بلد صاير قل لي بأي بلد صاير أشوفك وين يا